Could an overlooked cholesterol marker be putting your heart at risk? If you're like many people I meet, you may assume that you know your levels of harmful cholesterol. But what you don't know is that standard cholesterol tests usually skip a crucial marker called lipoprotein a. And if you've never heard of it, you may be missing vital information about your heart health. So that's what I'm going to break down for you today. I'm Dr. Daniel Gordon, a private GP, and I put a huge emphasis on preventative health with my patients. Over the years, I've helped patients with seemingly normal cholesterol discover they're at a higher risk of heart disease and stroke due to an elevated lipoprotein a level. So let's break down why this marker matters so much. Before we dive into lipoprotein a quick reminder about cholesterol and that standard cholesterol tests include total cholesterol, LDL cholesterol and HDL cholesterol, and these are what people are most familiar discussing. Of these cholesterol types, LDL is considered the more harmful due to its ability to cause furring plaques on the inside of our blood vessels. And it is these plaques that cause inflammation and blockages which, down the line, are the cause of conditions like heart disease and strokes. So where does lipoprotein a fit into this? Well, to keep things simple, you can think of it as a subtype of cholesterol which is particularly sticky and promotes inflammation and plaque formation to a really significant degree in the arteries. It's not routinely measured, but high levels can significantly increase your risk of serious conditions like heart disease, stroke, and heart valve problems independently of other risk factors. That means even if your other risk factors like LDL cholesterol or blood pressure seem normal. A key point here is that lipoprotein a is genetically determined, so lifestyle changes or medications like statins actually won't lower it. And because it's genetically determined, your levels stay stable throughout your adult life. Just one test can reveal if you have a hidden risk, and you do not need that test taken again. So you might therefore wonder, if it can't be lowered, why get it tested at all? Is there any point in finding out this risk factor if there's nothing you can do about it? Well, there are many things you can do, and this is the most important thing for you to understand from this video. I'm going to give you 3 reasons why getting your lipoprotein a tested is valuable. Number 1, figuring out your true risk of heart disease. If your lipoprotein a is high, it means that you have hidden risk which is not being taken into account. You and your doctor may need to consider being much more aggressive on your other heart disease risk factors, like your blood pressure or your LDL cholesterol levels, to give yourself the maximum degree of protection for your future health. Number 2, it can offer genetic clues. Finding your lipoprotein a level is elevated can help explain why you or your family have faced heart issues at young ages. This has the added advantage of increasing the chance that you can intervene earlier for other family members in the future, protecting them from a younger age. Number 3, staying up to date with emerging therapies. Whilst there are no direct drugs available yet to lower lipoprotein a, there are promising treatments around the corner. Knowing your level means you can keep yourself updated about upcoming treatments and therefore put yourself forward for them when they're available. So should you consider testing your lipoprotein a? Well, I believe everyone should, as it's helpful for gaining a true understanding of your heart health. But you may want to especially consider testing it if you've had unexplained heart disease at a younger age yourself, or a strong family history of early cardiovascular disease. So in summary, lipoprotein a is a cholesterol marker you probably haven't had checked, but it's crucial to understand your long-term heart disease risk. And even though we can't lower it right now, knowing it's high can guide more intense management of other risk factors and keep you ready for emerging therapies. Ultimately, the earlier you start to look after your heart, the more effective you can be at preventing long-term complications. So stay proactive and informed. Be sure to check out my channel for other topics that might be of interest. And, of course, hit subscribe or drop a like or comment to show your support, and so that I know what topics are of most interest to you at home. Look after yourself and see you soon.